Welcome back to the show. You know, when it comes to end of life, hospice care can make all the difference for both the one receiving it as well as their families. Take it from me, having the right hospice care for a loved one literally affects you for the rest of your life. So evening's Ellen Menny spoke with Evergreen Health about what both young and old need to think about.
Here at Evergreen Health, we have the ability to go out to people wherever they live, whether it's in private homes, skilled nursing facilities, adult family homes, et cetera, over all of King and Snohomish counties. And we also have an inpatient hospice facility where I'm sitting right now that's right across the street from Evergreen Health Medical Center. And that this beautiful facility is intended to be kind of like a cross between a home environment. So it's very cozy and comfortable, but it also has allows us the ability to care for people who really need more in-depth symptom management, usually care that can't be provided in a home environment. So we're very lucky to have that facility at Evergreen Health.
Yeah, absolutely. And I know, thinking about and making a decision with hospice, I imagine it's incredibly challenging, but it sounds like, making that decision and thinking about it early can really alleviate, a lot of stress for both the patient and the family.
Yeah, what we hear so often from patients and families, they say, oh my gosh, I wish I'd known about this earlier. And that's true here, and it's true around the country. And all over the country, we've seen a big change in the last 10, 15, 20 years, in which there's really an effort to make people understand how this system of care works and remove some of the fear and stigma of even talking about the reality that we all have an end of life.
And it's hard to talk about.
Yeah. There are efforts going on all over the country and here in our state in getting people, healthy people, young people, to talk about what their preferences would be if they were to get very sick or even, say, for example, to be in a car accident. Who would make decisions for them and that sort of thing. So for younger, healthy people, there is in our state a program called Honoring Choices to help start those conversations. And then all over the state and all over the country, there are more and more palliative care programs, which are programs that really are emphasizing an approach to people who have serious illness, in which talking about, even while people are getting aggressive treatment, say for cancer or other conditions, helping to understand the lay of the land can really, and what may be coming down the road in months or even years, can really alleviate a lot of anxiety. So that's what palliative care sets up people to understand better.
Absolutely. Dr. Wechkin, can you talk about some of the misconceptions and myths about hospice?
There are so many misunderstandings that people might have based on experiences from years ago with hospice. We really used to see hospice as something reserved more for the last days or weeks of life, but there's more and more of an effort to help people understand that it's really intended for the last months of life. And sometimes people come on to hospice and they actually stabilize, and sometimes they even get better. So we always ask the question, once a patient is on hospice, do we think that a person has a prognosis or life expectancy of 6 months or less from now? And in that way, because we're constantly asking that question over many months, sometimes a person can live with hospice services for more than 6 months, for 8 months, for a year, sometimes even more. So this idea that hospice is just when you're in the very last days of your life, that's a big misunderstanding. I think we also sometimes find that people think that hospice has to be a place where you go to get care. And the vast majority of hospice care is provided to people right where they are, with their families, with their pets, with everybody around them who they love in their own homes.
And that makes so much of a difference, I feel like.
Yeah.
Thanks to Ellen and Evergreen for that thoughtful conversation. Meantime, to learn more about the hospice services offered by Evergreen Health, please visit the website on your screen. And as always, we have links to everything on New Day's website. Well, a lot of us out here in the Pacific Northwest are concerned about our changing climate. Up next, a new book that takes a look at the physical impacts of global warming all around the world. We'll be right back.
This portion of New Day Northwest is sponsored by Evergreen Health.